Hi, my name is Chelsea Stokes, and I will be discussing a novel breakthrough in open-angle glaucoma treatment. So what is glaucoma? Glaucoma describes a group of eye diseases that result in irreversible blindness. The main cause is optic nerve damage from excess aqueous humor fluid, which results in elevated intraocular pressure, and also referred to as ocular hypertension. Intraocular pressure refers to fluid pressure in the eye, where the level and resultant damage differs between people. Vision loss occurs gradually and is usually experienced in both eyes. However, it can be worse in one eye than the other. Eye pressure is measured in millimeters of mercury, where normal levels range from 12 to 22. Aqueous humor is a fluid produced in the eye, and its role is to maintain intraocular pressure and overall health of your eye by supplying nutrition such as amino acids and glucose. In a normal eye, aqueous humor flows from the ciliary body where it is produced into the anterior chamber and is removed via a spongy tissue called the trabecular meshwork into a drainage canal. This maintains normal levels of pressure and vision, as seen on the left. However, in an eye with glaucoma, intraocular pressure is raised to levels above 22 millimeters of mercury. Pressure is raised when there is either too much fluid produced in the eye or when drainage canals or the trabecular meshwork are blocked, preventing fluid from leaving. Experts are still unaware of what causes the blockage, but some rare causes include chemical injury, severe infections, and blocked blood vessels in the eye. Since glaucoma can be asymptomatic, patients often lose a significant amount of peripheral vision before realizing that they have it. This can be seen in the image of the tree on the left. As you can see here, there are a number of different types of glaucoma. The most common is open or wide-angle glaucoma, where the trabecular meshwork appears normal, but fluid doesn't outflow normally. This is the type of glaucoma that we will be focusing on today. However, other types of glaucoma include angle closure or narrow-angle glaucoma, secondary, normal tension, and lastly, pigmentary glaucoma. So who is currently being impacted? Glaucoma is one of the leading causes of irreversible vision loss, and even though it is more common in the elderly, it can occur at any age. It is currently estimated that 2 out of 100 Australians will develop the disease in their lifetime, with chances being even greater for those aged over 80. Over 300,000 Australians currently have glaucoma, with almost 50% of patients being undiagnosed. There are a number of risk factors that increase an individual's chances of getting glaucoma. Those of a particular demographic, aged over 40, with secondary conditions, with poor vision, and with a family history of glaucoma, are at much greater risk of developing this disease. Worryingly, glaucoma often has no symptoms or warning signs in its early stages. However, some common symptoms can include vision loss, seeing halos around lights, eye redness, hazy eyes, and an upset stomach or even vomiting. Even though there is currently no cure, individuals who have their eyes tested regularly and follow their treatment plan can prevent and significantly slow the progression. Treatment usually begins with topical medication or eye drops. However, patients can also receive oral medication and laser eye surgery such as a trabeculectomy, which work to increase the outflow of aqueous humor and reduce eye pressure overall. Vyzulta has been improving the lifestyle of patients since it was approved by the Federal Drug Association in November of 2017. Vyzulta is a modified version of a current class of prostaglandin analogues, but with the added component of butanediol mononitrate, which releases nitric oxide. The nitric oxide activates a signaling pathway that widens intracellular spaces in the trabecular meshwork, relaxing the area and increasing fluid outflow. The nitric oxide also helps to dilate blood vessels, increasing oxygen supply to the optic nerve and improving fluid drainage, preventing further optic nerve damage. So how has it helped improve patient lifestyles? Glaucoma surgery carries risks of temporary and permanent blindness and requires several follow-up appointments. Current eye drops can also have hypertensive and adverse reactions and have to be administered 2 to 3 times a day. Vyzulta has actively improved the lifestyles of glaucoma patients by reducing recovery time from surgery, can be easily administered once daily, and carries minimal risk and safety concerns. Vyzulta is the perfect first-line treatment option that has been shown to be more effective than current treatments and can be used alongside other medications. Vyzulta has been able to both preserve eyesight and prevent glaucoma, as it is the only drug that promotes blood flow to the optic nerve while also reducing pressure by promoting drainage through the uveoscleral pathway, as shown in this diagram. Therefore, it provides a combined therapy that no other single drug can provide. This added component gives Vyzulta a unique mechanism of action, providing an efficacy edge over other treatments. Thank you for listening. I hope you have enjoyed this presentation, and I hope to see you later.